Security is a major challenge in our country, Kenya. To this end, my government has so far installed 537 CCTV cameras in 8 towns, 4 highways, and 10 government institutions to help fight crime and reduce the level of insecurity in our country. We were the first the first government to buy vehicles for the police, so that you don't call the police and they tell you, utume gari. We bought vehicles for the police, and those vehicles are still in operation today across the county because we care about security. As a result of this installation, Machakos remains one of the safest counties in Kenya and is consequently becoming a big attraction to new business and investments. We have distributed 6,616 bags of fertilizer to 23,245 farmers and 795 tons of different seeds to 279,510 farmers. We have also plowed 12,932 acres of land for 12,107 farmers and gone ahead to focus on creation of value addition that benefits farmers. We have also set up a new hatchery from which we have distributed 132,846 chicken to 14,227 poor households throughout the county. There is no village in this Machakos County that has not benefited from the free chicks and chicken that we've in this county. Machakos is a region that is defined as semi-arid, but is now the largest producer of fish in Kenya, with the biggest fish farm in this country being domiciled here in Machakos County. My government has focused on fish production and set up a fingerling hatchery. To date, we have distributed 211,500 fingerlings to fish farmers. We have supported these initiatives further by empowering our extension officers through provision of 49 motorbikes to help them visit our farmers more conveniently. Madam Speaker, it is because of these initiatives and many more that today I'm proud to inform you that Machakos is no longer relying on relief food, but is on the path to become a net exporter of food to feed the rest of the country. Madam Speaker, cooperative societies play a significant role in our economy, and I'm pleased to report that my government has facilitated the registration of 183 new societies since 2013, which benefit over 40,000 members. We have also helped build capacity to 33,509 members from 321 cooperative societies. The members have managed to save a total of 2.8 billion Kenya shillings, which has helped more than 67,000 members to access financing for personal and business growth locally. In terms of value addition through cooperative societies, Machakos has processed over 6,000 tons of coffee from 88,673 farmers. I say Kamitu smiling because they come from that region of coffee with Kangundo, bringing in over 2.1 billion shillings to our farmers. Coffee was dead when we got in here. Now it is giving our people money. We are looking forward to a more income as the coffee prices continue to improve and as we now aggressively reform and revitalize the sector. Madam Speaker, when I took office, I promised our people that I would fix our roads so that our mothers will no longer give birth by the roadside or our sick die on the road as they struggle to get to the hospital. It was sad that in 2013 we still had to carry the coffins of our loved ones on our shoulders due to the bad conditions of our road. This is why my government prioritized road construction and invested heavily in this sector. In total, we have tarmacked nearly 100 kilometers of new roads using our county resources, graded over 3,600 kilometers of roads since 2013. We have also constructed many drifts, bridges, and installed culverts to manage storm waters. From this summary, Machakos is currently the leading county in road development in Kenya. Madam Speaker, honorable members, in trade, enterprise development, and investment, we have constructed 53 new market sheds, benefiting over 25,000 traders and creating market reach for more than 100,000 farmers countrywide. We have constructed 5 bus stops and set up a business incubation center, which will benefit about 2,000 Machakos residents annually. We have also provided 158 boda boda sheds to our boda boda drivers. Towards cutting down costs and making our paving affordable, we have built a cabro making factory at the Machakos new city grounds, and will now be able to come to your towns in all the worlds and be able to lay cabro, because we have our cabro making machine. Besides, my government has built 66 modern public toilets across the county, with 47 others still under construction. In 2013, I promised our people that provision of water will be a priority. I'm proud to inform this Honorable House that Maji ni Haki Yako household water program has succeeded, and we have reduced the average distance to and from water sources from 12 kilometers in 2013 to 3 kilometers today through the county. The adoption of solar-powered boreholes and treatment works have also made the projects financially manageable. Maybe I can also ask the question, where else in this country would you find boreholes operated with solar, where wananchi don't have to pay to power generators or pay for electricity? Only in Machakos County. As of today, Madam Speaker, my government has built 8 new water treatment plants, 8 that you can go and see and touch. We have 4 mega dams that we've built in your areas that you know. We have another 370 earth dams across the county, 298 weirs across the county. We have drilled 617 boreholes, which have helped us to provide access to clean and hygienic water for both domestic, livestock, and agricultural use. Let me repeat myself, Madam Speaker. We have drilled 617 boreholes, which are solar powered. Where else in this country, Kenya, will you ever find a county that has drilled not 400, not 300, not 200, not 100, even 70 new boreholes? Nowhere, only in Machakos County. We have distributed 2,000 water tanks of 10,000 liters across the country, and we also have elevated 17 50,000 liter mega tanks to help distribute water to our peri-urban and urban areas. When I ran for office, I talked about showers. We have built, we have constructed, we have laid 415 kilometers of new water pipeline in the entire county. In addition to this, as a result of our water program and part of our environmental conservation program, we have planted over 3 million tree seedlings, which will benefit over 70,000 residents. When I became governor in 2013, and most of you will attest to this, and you're walking around Machakos, you are hit with a foul smell nearly 200 meters from the gate of the then Machakos General Hospital. Patients were sharing beds, at times 3 to a bed, all suffering from different ailments. Our health facilities had no water, were dirty, and provided very poor treatment. Our county, with more than 1.2 million people, had about 4 ambulances, and none was functioning. Pregnant mothers were being ferried by wheelbarrows, and the sick were bundled on kokotenis. Children were born by the roadside and named Nzelani or Mwanzia, who were in a pathetic state. As you are aware, health is a fully devolved function. Provision of health care is a human right under our Constitution and international treaties. As I've highlighted before, above, our health care was in shambles. Our women were giving birth on the roadside, and the statistics for women who gave birth through the assistance of a trained health professional were alarming. You know, women could not get to hospital because there was no transportation to get them to hospital. That's why they were giving birth by the roadside. I immediately bought 70 van ambulances, 1 for each location, and 10 motorcycle ambulances for the hilly and formal settlement areas. Recently, we added another 5 high dependency ambulances. Madam Speaker, in order to ensure health services are close to our people, we have opened 38 new dispensaries, 13 new health centers, and 15 community hospitals, each with maternity, mini theater, and X-ray services across the county. We have also We have also upgraded to have a level 4 hospital in each of our 9 sub-counties, moving from the initial 3 that we found in 2013. Madam Speaker, healthcare cannot be provided without qualified healthcare professionals. The statistics show that there was a huge gap between the recommended WHO healthcare cadre to population and the workforce on the ground. This is why I initiated reforms that have ensured employment and doubled our healthcare workforce from 1,338 personnel in 2013 to 2,913 currently. This spreads across specialties such as doctors, pharmacists, nurses, clinical officers, medical lab professionals, counselors, among others. Madam Speaker, the reforms initiated in the health sector have made Machakos to be recognized both nationally and internationally. Many local and international universities are using our hospitals for teaching and research. We are the only county in Kenya to have installed a cancer care and research center. Patients today no longer have to share beds in the maternity and hospital wards, respectively. Our modern cancer treatment research center and renal unit provides affordable, life-saving testing and treatment to our residents, and we have distributed health services to all corners of the county. And I want to thank this Honorable House because we've approved our budgetary allocations, and as a result, our citizens are enjoying medical services under our universal healthcare program. Indeed, I'm proud to say that we are the only county in Kenya, and perhaps in East Africa, if not East and Central Africa, or even the total of Africa, that you'll find a fully equipped and functional ambulance in every administrative area. To date, our ambulances have responded to over 693,000 emergency cases. Now, what does this mean to all of us? Maybe the question should be, where do you get 100% universal health care in Kenya? Only in Machakos County. Where in Kenya do you have new community hospitals meeting World Health Organization access standards? Only in Machakos County. Where in Kenya do patients not share beds? Only in Machakos County. Where in Kenya do you have the highest nurses population rate? Have the highest number of nurses to population ratio? Only in Machakos County. Where in Kenya do you have an ambulance basically in every administrative location? Only in Machakos County. And where in Kenya do you have a county-run cancer center? Only in Machakos County.